We're back at Mountain Health today talking with Scott Baker, Vice President of Provider Services at Tahoe Forest Health System. We're talking about clinics. We're talking about multi-specialty clinics. Let's take a deeper dive into the diversity of services in the multi-specialty clinics. Specifically, what are they?
Well, we might fill up the whole segment with this. So
that'd be fine.
So we have all your heavy hitters, the very common ones: cardiology, pulmonology. Everybody knows about our cancer center when they're driving down Donner Pass Road. Very strong oncology center, cancer center. We have things that you don't normally find in a rural community. A very highly functional urology program, neurology, endocrinology, GI, gastrointestinal. General surgery, pediatrics, a great pediatric crew that's grown tremendously over the last couple of years. I'm sure I'm missing some, but we have a wide range of not only medical specialties, but support specialties such as physical therapy, occupational health, care coordination, behavioral health, things of that nature.
The reason I ask is in your prior career, you came from a larger market place, and that would be fairly common to see that array.
Sure. Yeah.
The Lake Tahoe area is kind of unique. It's rural, but it's also not rural.
Yeah.
We talked about it a little earlier. We have a lot of expansion. We have quite a second homeowner population.
Absolutely.
So we serve many different groups of people. Did you find that to be a challenge in developing a diverse array of clinic services in this region? Did you believe for a moment that it couldn't be done?
I knew it could be done, but I knew it would be a challenge. It's a very different approach to build a program where you know based on the community and based on the needs that it might only end up being one or two providers versus a large metropolitan area that might have 10 or 12 providers in a program. So that's a very different approach, but it's doable if you do it right. And we've expanded not only the scope of our current services, but added a few different service lines over the last couple of years, to meet the needs of the community as we expand our footprint.
Earlier you had said that you listen to your patients, and that's how you find it very helpful to determine what those unmet needs are.
Absolutely.
You still see unmet needs. You're not done with your work.
Not at all. In fact, I can't name one service line that we're perfectly meeting the needs of the community. We're close in some, and certainly we'll continue to address those needs as we move forward. Some of the service lines are just tougher to grow than others.
Well, it's also a race. I mean, we have a community certainly that's growing.
Right.
So you might feel like you've met the need. You turn around in a couple of months and your demand is high.
That's right, and we keep an eye on that. Again, listening to the patients, seeing where our patients end up going for care that we might not be able to provide in our system. We continue to look at that on a routine basis.
Have you received feedback from patients that perhaps have lived here a long time and are pleased with the services that are now here?
Constantly, yes. As we bring in those new service lines, those patients needed care, but in many cases they had to go to other cities and other areas to get that care because we didn't have those services in-house. And as we've brought those services in-house, now they're taken care of at home in their community where they live, and that's really our main priority.
Well, and as the word spreads, are you seeing in migration?
We are, especially like I mentioned, those service lines that are underserved across the country. Urology, neurology, GI again. A lot of those patients we're seeing come from further and further away because they can't get the care they need in their communities.
To the north, perhaps?
To the north, to the west, to the east, to the south. Yeah,
so
we're getting
everywhere.
Patients from everywhere.
Everywhere. Share with me a little bit about your view of unmet needs. What do you see as maybe the most growing, urgent unmet need of the next 5 years? What's high on your priority list?
I think immediately it's behavioral health. That's a need in almost every community across the country.
Is that a challenge? I know that the need is great nationally, and therefore the people that provide those services are competitive.
They are, but we as a system have invested in that service line. Part of the difficulty for behavioral health is that it's not very well reimbursed. It's not a concentration for the insurance company.
Is that true of both commercial,
yes,
Medicare, Medicaid?
Yes, it's very difficult to get reimbursed for the level of services that people genuinely need. But we as a system, because we are community-based and we're here to meet the needs of the community, we as a system have invested in that service line to make sure that we're trying to meet the needs of the the community, even if it's not even a break-even endeavor for us. We really invest in that for our patients.
Would that be done with on-the-spot providers, telemedicine, telepsych, or a combination thereof?
All the above, that's right. We currently have telepsych available to some of our patients. We hope to expand that this year. We have incoming providers planned for this year that you'll see integrated into our primary care clinics to provide the care when it's needed and immediately, as well as being scheduled for those patients who have those needs in our community.
Youth as well?
Absolutely. Our long-term goal is to integrate behavioral health in all of our primary care clinics as well as pediatrics.
So we've talked about the specialties, we've talked about primary care, we've talked about the fact that you are expanding your clinic footprint and presence throughout the region. How do people find out about you? How do they access?
The easiest way is to go to tahoeforest.com or tfhd.com. That provides a full menu of services that are available to our patients, as well as contact information for all of those service lines.
Of course, you have a phone number that will appear on the screen, 582-1212, and the 530 area code for additional information. Scott, do you see your activity week to week slowing down, or do you think it's going to be hectic and feverish?
I think it'll continue to be exciting and continue to grow. I easily see us doubling again over the next 5 to 10 years as we continue to meet the needs of the community.
Very good. Thank you for the work that you do on behalf of the community.
Thanks.
Been talking to Scott Baker, Vice President of Provider Services for Tahoe Forest Health System. I'm Ted Owens, and thank you very much for watching Mountain Health Today. Welcome back to Mountain Health Today. We're talking with Scott Baker, Vice President of Provider Services at Tahoe Forest Health System. Scott, we've been talking about clinics, the MultiSpecialty Clinics. Let's talk a little bit more deeply about the multi-specialties.
Sure.
I'm curious about the breadth and depth of those clinics and the services that they provide beyond primary care, cuts and flu and cough.
Sure. So as we expand primary care, the growth in primary care in that patient population will begin to feed additional needs for specialty services. So we've concentrated on that over the last couple of years as well, and we've added not only new providers in our existing service lines, but added new service lines such as endocrinology, neurology, expanded capacity in GI, a lot of things that are not inherently normal to a rural hospital system, but we provide those services to our community because the need is in the community.
How did you determine that need? How did you know what it is that the community was looking for?
We listen to our patients. When they present to a primary care physician and a service is needed that we don't have in our system and we have to refer out, we track that. We look at that and we determine what we can bring in-house, what's appropriate, and whenever possible we try to do that.
How challenging is it once you've identified a need? You know, there's a lot of moving parts to put a clinic together like that that's got specialty involved. Start to finish time frame typically? Does it take a year to build? Or
it can, certainly. If it's a brand new service line for us, before we see our first patient, we have to set up everything from the billing and revenue cycle side of things, making sure we have the resources that that provider and those patients will need to be properly cared for. But once we identify the need, we try to move on it pretty quickly. And in some cases, just recruiting the provider is the most difficult part. Some specialties like GI and neurology, those are underserved across the country. And anybody who needs those services is probably run into long wait times, and in some cases having to travel a great distance just to see a provider of that specialty. So that's why we try to bring those in-house.
So when you're trying to bring in new providers, volume is of course a question.
Of course.
And I would imagine this is why a lot of those specialties don't exist in a rural environment.
Right.
We're a little bit different. As we talked about earlier, we flex and grow and change, and we have people moving here.
That's right.
Share with me the challenges that you go through when you're trying to recruit a provider for a needed specialty. Is there enough volume to make it worthwhile for that provider?
That's one of the big questions that we ask up front to make sure that we can support a program. The last thing we want to do is to start a program and bring in a provider and not be able to sustain it. So before we go too far, we make sure that we can sustain it internally. And in some cases, that's through partnerships with other systems and other organizations to share those resources. And in some cases, it's maybe only bringing somebody in part-time. So we're careful not to bring in and start a service line that we can't support long term.
But the goal is, of course, to provide a service that is needed by the community.
That's right.
Any which way you can slice or dice it and make it happen.
That's right.
It is a challenge.
Absolutely.
What do you see on the horizon in terms of need? I mean, you've talked about GI, and what do you see on the horizon for future needs?
Many of our same service lines will continue to expand on. GI is a good example. We have new providers coming in early in 2020. Cardiology is another growth area for us, another provider is coming. Some other newer service lines for us, such as behavioral health, which we've identified long ago as a big community need. We have 2, potentially 3 providers coming in 2020 to help support that program. So that will be a substantial growth for us in that area. But most of our service lines will experience some growth in the next few years until we meet the demands of the community.
Some specialty service lines, you've had great providers for many, many years in the community. Very blessed to have had them.
Absolutely.
But they're not going to practice forever. So you've got to find replacements for some of our long-term providers.
That's right.
And that's on your horizon as well.
Absolutely. We keep an eye on that. We talk to our providers pretty continuously, those who have signaled that they may be retiring or doing something else in the future. We stay in contact with them and try to plan for that at least a year or 2 in advance, so we have plenty of time to replace those.
Are they willing very often to ramp down, slow it down, integrate new providers, kind of as an introductory type of thing to their clientele?
Absolutely. Most are willing to slow down over time. Some find retirement appealing until they start to retire, so they end up staying a little bit longer than they planned, and we support that. We want them to stay as long as they feel comfortable.
Are most of the specialties within the multi-specialty clinic program, are they located near the campus, or are they located throughout the region?
So we look at that. So most of our specialty services are on our main campus in Truckee. We do have a menu of services in Incline Village as well. As we continue to grow, we understand that more and more of our population is coming from outside the main Truckee population. So without going into other districts, we look at community outreach clinics, putting primary care there. Tahoe City is a good example. As we expand primary care there, we will look at providing additional specialty services there as we identify the patient population that comes from those communities.
And then many of the clinics, Squaw Valley,
That's right.
North Star, are more primary care, urgent care?
Mostly urgent care, just by the nature of the people who come into those communities, but our long-term vision is to have more services there. Right now, those are seasonal sites, but we could easily see that in the future being year-round sites for different services.
So you're seeing more need for urgent care clinics, primary care, specialties.
That's right.
Throughout the region. So is that part of the long-term plan, is expansion of clinic locations?
Yeah, that's right, and that's part of our strategic plan. Part of my job, and if not my main job, is to try to keep people out of the hospital, which sounds funny to say, working for a hospital, but really that's our goal. The people who end up in the hospital need to be appropriate to be in the hospital. If we can manage those patients and keep them out of the hospital through specialty services and primary care, that's our goal.
Scott, thank you very much for being with us today. We're talking to Scott Baker from the Tahoe Forest Health System. We'll be back in just a minute. You're watching Mountain Health Today. I'm Ted Owens, your host. My guest today is Scott Baker, Vice President of Provider Services for the Tahoe Forest Health System. Scott, welcome. Thank you for being with us again.
Thank you.
Good to have you, and glad you made the time. Today we're going to talk about new service lines in the Tahoe Forest area that you've been a great part of building. Share with us what that is.
Well, we've grown tremendously over the last 5 years, really. I came on board in 2016, and from 2015 to projected in this year of 2020, we've doubled our outpatient clinic visits, and that's impressive and a challenge for us, but we've done that through multiple service line integrations and additions, as well as just adding providers to our existing service lines, being more efficient with our clinical spaces, building new clinical spaces, with really a goal overall to meeting the needs of the community that we serve.
Precisely. I was going to ask you about that. This has a lot to do with the growth that we've seen in the entire Lake Tahoe area.
That's right.
In the Truckee region. And we know that the demographic is largely the older generation, 65 and older, is the fastest growing area.
Right.
And you found when you got here we had a strong need in primary care and clinical services.
Correct. Several areas, but primary care was probably the biggest need. Knowing that primary care is the front door to the system for a lot of people. It's their first contact, either through annual visits, just routine checkups, or having that fever, strep throat, sore throat, whatever it is. That's usually their first contact, and that starts the process of integrating those patients into our system and caring for those patients throughout their lifetime.
Brings about a question of access. Mm-hmm. Access was a problem.
Yes.
And so the 7-day aspect of the clinics was key.
Correct. Yeah, so access was an issue. There were long lead times, long wait times for patients to get into their physician in many of our areas. Primary care was a good example of that. Early on, it was not uncommon to have a month, 6 weeks, 2 months of wait time to get into your doctor. And when you have a primary care need, that's just unacceptable. So we are where we are now with the additions and expansion of our services. We have same-day appointments every day, 7 days a week, both in Truckee and in Incline.
I want to go back a little bit, though, because you had to build it. It sounds simple, might sound simple to the folks at home. 7 days, how hard can it be?
Right.
How did you lay out a plan to actually build that? Because that's not an easy thing to pull off, to make happen. So where'd you begin?
Well, we had to have the right resources in place. A few years ago, when this expansion started, we had a few primary care providers. Many of them were also specialists that did part-time primary care, and we've expanded that to have, sometime in 2020, we'll be up to about 20 dedicated primary care providers. So that greatly expanded our capacity to see primary care patients. Once we have the resources on the physician ranks and the provider ranks with nurse practitioners and PAs, then we have to staff up to support those providers. New facilities were needed, and we're in the process of building those. We have some that have already opened, and then from there, all the support services that go along with seeing the first patient. Before you see the first patient, you have to have all the medications in place, you have to have scheduling in place, and everything else that comes with it. So it was a job to get ready for it, but once we turned it on and expanded our capacity, the patients have really enjoyed the access to that, and it's improved pretty dramatically.
So for the folks at home, Tahoe Forest, its district is rather large. So it's eastern Placer and Nevada counties, also Incline Village. So clinics are located throughout.
Correct. We have multiple locations in Truckee proper on our main campus. We have Incline Village with our sister facility there. Through our partnership with TTMG, we have locations in Tahoe City now, Squaw Valley during the ski season. So we're really starting to get our footprint a little bit larger to match that geographical spread that we have in our community.
And others to come, I would imagine.
There are definitely more to come.
More strategery there. So tell me a little bit about, you've mentioned walk-in, same-day appointments are available.
Yes, sir, every day.
Walk-in did not exist before.
That's right.
There was long wait times. Are you battling the wait times? Is it still a challenge to manage? Is the need really a big driver and a challenge for you to try to meet that need on a walk-in basis?
Yes. In some areas, we've made some pretty measurable improvements. Primary care, as I mentioned, is dramatically improved. Our goal is to get every patient that needs to be seen in primary care in that day, and for the most part, we're getting very close to accomplishing that. In some of our specialty areas, it's more of a challenge. That's why we're building new facilities and making that investment so we can continue to expand our capacity to continue to meet those needs as they grow.
Now, in primary care, one of the challenges that you face, of course, is you've got about a 40,000 full-time residency population.
Right.
But same-day services, walk-ins, very important to our second homeowners, our folks who are visiting, where our population can expand radically on a weekend.
That's right.
Is that the stressor that you deal with, or is it general population?
Both. Obviously, on a busy weekend, when our population triples or quadruples, we've got to staff up for that and be ready for that. Walk-in appointments are available every day, and when the seasonality changes, we look at adjusting those walk-in appointments to make sure we have capacity. In some cases, we do add providers, and again, as we expand our urgent care service line, that will always be available to our patients, again, 7 days a week.
So 7 days a week, including holidays?
That's right, 365.
7 days a week. You're watching Mountain Health Today. I'm your host, Ted Owens. Been having a conversation with Scott Baker at Tahoe Forest Health System about primary care clinics and clinics availability 7 days a week. We'll be back in just a moment. Welcome to Mountain Health Today. I'm Ted Owens, your host. Mountain Health Today is a program bringing to you topics of healthcare that are of great interest to the community, the people that we serve. You can watch Mountain Health Today on Lake Tahoe TV and Truckee on Channel 14, North Lake Tahoe Channel 195, South Lake Tahoe Channel 12, and of course all programs are available on tfhd.com. We'll be back in just a moment.